The U.S. war in Afghanistan is the longest military conflict in American history.
Section 4!
Many of the troops who fought there also saw combat in Iraq, and doctors say at least 1/3 returned with mental health problems. Dr. Michael Yokelson was part of a military medical team that assessed returning soldiers for post-traumatic stress disorder and traumatic brain injury.
I think it's going to be really critical that those personnel are identified and get into therapies quickly.
But what kind of therapies are most effective? Researchers studied a group of more than 140,000 U.S. military veterans who had served in Iraq and Afghanistan between 2005 and 2010, and who had been prescribed an opioid, a narcotic, within a year of getting a pain diagnosis at a veterans hospital. Dr. Karen Seal is a co-author of the study.
Veterans who had mental health diagnoses, but particularly PTSD, were far more likely than their counterparts without mental health problems to receive opiate pain medication.
Veterans with PTSD were 2.5 times more likely to be on these narcotics. The researchers also were concerned about the quantity of drugs prescribed.
These patients tend to receive higher dose opiates than their counterparts and would request early refills of their opiates, which indicates that they're using them more quickly than they should be.
Many of the veterans on these drugs, whether they were mentally ill or not, had higher rates of accidents, alcoholism, violent injuries, suicides, and overdoses. Dr. Seal says the findings demonstrate that alternative methods of treatment, such as physical therapy, talk therapy, or acupuncture, should be offered more widely.
The study really woke us up to the reality of the serious adverse consequences that can occur with the use of opiates in returning Iraq and Afghanistan veterans who have pain and mental health problems.
Dr. Yokelson says treating post-traumatic stress disorder will take more than a quick fix.
Frankly, if they've been on multiple deployments and perhaps been there for 12 or 18 months or longer, or even over a period of several years, several deployments, and never had it addressed until now, I think that treatment period may be going on for several years and maybe indefinitely.
The study was published in the Journal of the American Medical Association. Melinda Smith, VOA News.
I think somebody wants to see you, Dad.